The Shushabye Airway is perfectly compatible with mask ventilation, which will fit over the mouth and won't interfere in any way with that, and will work just as well as these other airways will work to keep the airway open. It will be FDA registered, and one of the things we want to talk about also is not just the emergence from general anesthesia, but the exploding number of procedures requiring sedation. One of the commonest of which is upper endoscopy. The Shushabye airway may be uniquely suited for upper endoscopies because it will, like the bite block currently used, allow the endoscopist access to the patient's hypopharynx while keeping the airway open. If you look at endoscopy literature, you'll find that the biggest problem with upper endoscopy is hypoxia. In fact, the biggest problem with all sedative procedures is hypoxia. And this airway can be used in those circumstances because you can very lightly sedate the patient, especially these days when the patients tend to be much sicker, older, and in many cases more obese with more airway problems. The Shushabye airway helps hold the airway open while they're mildly sedated without gagging them or causing them any difficulty. In fact, you can just allow the patient to emerge completely from their sedation wide awake and let them remove it themselves. Just a couple of quick statistics on these sedated procedures, the out-of-operating room procedures. There are 7 million upper endoscopies, upper GI, EGDs, done every year. There are a total of 70 million endoscopies done, gastroendoscopies, including a lot of very invasive ones, which require deep sedation. And there are 15 million colonoscopies, which this airway may be helpful for. Again, the problem with most of them is with sedation and obtundation, the patients become airway obstructed and hypoxic, and our airway may help with that. There are 1 million cardiac caths and 1 million cardiac caths and angioplasties done. 3 million cardiac caths and angioplasties done every year, and 1.5 million invasive radiologic procedures like lysis of clots in a stroke. In circumstances where this is not done with general anesthesia, the Shushabye airway may be very helpful by keeping the airway open and allowing very light sedation when sedation and anesthesia may be dangerous to the patient. And finally, stop.